We live in a time like never before, facing an unprecedented situation, one that requires fast, correct, and impactful leadership decisions. We face a global pandemic called COVID-19. And today, we're going to go over how not only our world leaders address the situation, but how our global organizations and how one of our billionaire entrepreneurs are fighting to combat this epidemic. Our group consists of Armin, Austin, Bradley, Brian, Bruna, and Evan. We are the leadership during the global pandemic of COVID-19 group. Coronavirus tests world leaders like never before. The coronavirus, which surfaced in a Chinese seafood and poultry market late last year, has spread to at least 177 different countries, killing more than 170,000 people and sickening almost 2.5 million in a matter of weeks. The World Health Organization has declared the situation a pandemic. The decisions world leaders make to fight the pandemic and their ability to communicate them effectively determine whether millions live or die and whether the global economy stays afloat. The main problem that leadership has to address from our research is how to effectively deal with COVID-19. While we have multiple solutions on how leadership could address this issue, we will mention the main 5. They consist of tracking and containing the spread of the virus, increased and rapid deployment of testing, and effective treatment for those who already have it, developing a vaccine to keep new people from getting it, and effective global guidelines and policies for social behavior and sanitation. So what leaders should execute this solution? We think mainly it should start at the highest levels of leadership and work its way down. And on the side of the slide, we have a list of the different leadership theories and approaches from the book that we will be using and covering during this presentation. We will also note how they are used by different leaders around the world. The World Health Organization, or WHO, as it is also known, is the directing and coordinating authority on global health policy. WHO's leadership is essential to fight the spread of COVID-19. Contributors of WHO's 6 regional offices are renowned medical experts and scientists who perform research and theory on important health risks facing each of their regions. WHO aggregates and analyzes this data to provide guidance to the world. The WHO alerts the world to threats, fighting diseases, developing policies, and improving access to health care. WHO also provides up-to-date information on infections and deaths related to COVID-19, as well as the development and use of virus testing, vaccination, and available medical equipment. The concept of power is related to leadership because it is part of the influence process. Of the 6 bases of power by J.R. French and B. Raven, WHO clearly exemplifies expert, legitimate, and information power to influence the world on coronavirus. Their expert power derives from their medical doctors, scientists, biologists, chemists, psychiatrists, and epidemiologists. Their legitimate power being as they are an organization that has existed for over 70 years on fighting infectious diseases. Information power being from the compilation and vast research from their 6 regional offices that they provide to the world. The World Health Organization's leadership aligns with the skills approach model of leadership because of its knowledge and competencies concerning infectious diseases. WHO has led to the global fight against infectious diseases such as smallpox, polio, SARS, and the Zika virus. The infrastructure of the World Health Organization fits Robert Katz's 3 skills approach of combating technical, human, and conceptual skills to accomplish a set of goals or objectives. In the case of COVID-19, WHO has kept the world informed. It has mobilized scientists, coordinated data and research, and collected detailed evidence to put clear guidance for handling this disease. However, WHO has no governing authority and relies on the government to enact and enforce legislation using the recommendations. Now we will be moving on to our first country that we will cover, which is Brazil. The majority of cases of coronavirus in Brazil are in Sao Paulo and Rio de Janeiro, which are the wealthier states of Brazil. The mayor of Sao Paulo made an emergency alert closing schools, museums, and other activities. The government also asked for people to stay at home in a volunteer quarantine and avoid social contact in order to decrease the transmission of the virus. Since this was a personal choice and not state mandated, the population ignored the coronavirus issue. The president of Brazil, Jair Bolsonaro, is now begging Cuban doctors that he has expelled previously in his term to return to Brazil and work in the remote areas of the country which lack medical assistance. The quarantine is just required for those who had tested positive for the coronavirus. With an incremental amount of new coronavirus cases in the country, the government opened more rooms in public hospitals to combat this issue, as well as allowed the tax-free importation of medical equipment. With this case, it is possible to identify several leadership approaches and features. The mayor of San Polio showed some determination with his effort in closing schools and other services. His initiative showed his determination trait leadership style. He also showed dominance at the specific time in order to direct his followers. Brazilian leadership was also seen with the sociability trait by being sensitive to the needs of others. This was exemplified with the action of canceling schools, services, and introducing tax-free importation of medical devices, and trying to increase the number of health professionals, as previously noted. The case of the Brazilian government also showed the behavior approach in their opportunism. While working to make the best of the situation, they moved classes to an online format. The situational approach, also identified as a supportive style, was shown in this pandemic situation by Brazilian leadership. The government was very supportive by asking for follower input, such as volunteer quarantine and avoiding social contact. On the other hand, it seemed that the directive behavior was low near the later weeks because the government did not prohibit protests and other events that would have reduced the spreading of the virus. We noted that the population acted as a follower that has low commitment. This could have been combated by the government showing a more directive behavior and following the coaching leadership style. Now moving from Brazil, we will be going on to our second country, Italy. When discussing Italy, a good observation that has been made is that the leaders of Italy have been a strong example of what not to do as a leader when confronting a crisis. Italy has seen a rapid increase in COVID cases over the past weeks. On March 1st, the number of cases even jumped 50% in one day. The rapid rise in cases in Italy has proven to be a test for the leaders of this country. The leaders were slow to respond to this epidemic and failed to coordinate across the country to make a unified effort against the spread of COVID-19. After the first cases came to Italy, the leaders of the country assured the population that there was nothing to worry about and that everything was under control. Then, 2 days later, schools were shut down, sporting events were canceled, and tourism areas were also shut down. This mixed message and confusion led to the distrust among the Italian followers about their government's leadership. The response of the Italian leadership are a great example of an open system and the falls of assigned leadership, and as well as the behavioral approach. The overall scenario that we are examining provides a view of an open system of leadership. Italy is a part of a larger environment and must adapt to combat the intruding virus. This shows how an organization must be able to deal with outside effects. Another theory that this case shows us about is assigned leadership is not always the leadership that an organization needs. The leaders of Italy failed to quickly and effectively respond to the threat of the virus. Even though the leadership was well-defined and appointed, their skills failed to handle the task at hand. Finally, the scenario presents us with a view of the behavioral study of leadership. The officials wanted to please the people by making them feel assured that the virus was under control, when in reality everything was spreading, and they were taking little action to deal with the threat. The officials focused heavily on the people side approach rather than also addressing the result side, focusing more on a country club leadership style on the Blake and Mouton managerial grid. Italy was one of the first countries with a rapidly growing infection rate. As an early infected country, there was not a great example to follow, which made this a new test for the Italian leadership. After an early reaction that was not effective, the Italian leaders took another approach. They decided to order a lockdown of the nation. Though the results were not immediate, the results are seen in the weeks to follow. This is an example of the adaptive leadership model. With no example to follow, the Italian leaders must make decisions based on the information provided. Given the advice from several organizations with expert knowledge, such as the WHO, Italy acted with a shutdown. This adaptation and to the changing environment led to the results seen in the figure below. These actions made a vast improvement from the initial poor reaction. The results that Italy has seen has set an example for other nations to follow. Now leading on to our final country, England. With the case of England, the first confirmed case of coronavirus appeared in late February 2020, forcing the English government to act. New regulation was passed, including a 3-phase plan that included containment, delay, and a mitigation phase, while continuous research on the virus would coincide with its implementation. Large crowds were discouraged as the government closed all schools and canceled sporting events. With the rate of infection rapidly increasing, England moved into the delay phase in early March before Prime Minister Boris Johnson put the country into lockdown on March 23rd. The rapid spread of the coronavirus has created many new challenges for the English leadership to overcome, with many of its citizens criticizing the response. Many believe that the government should have acted sooner to prepare for the virus. The National Health Service is currently overwhelmed with patients and is in dire need of equipment and funding as the rate of infection increases exponentially. As unemployment also increases and continues to snowball, many business leaders have modified their businesses to aid the NHS while keeping their staff employed. The effectiveness of the English response can be directly tied to various leadership theories. As we discussed in the previous slide, many business leaders have shown their ability to adapt to new problems. By modifying their business models to aid the NHS, banks have also tried to ease the effects of the virus by allowing for mortgage holidays. This ties with the social contract doctrine of the Kohlenberg model, which postulates that leaders make decisions based on what is good for society. On the other hand, we can look at the trade approach to see how other leaders have stumbled in their response. As mentioned previously, Prime Minister Johnson has been criticized for his government's handling of the outbreak, with many showing a lack of confidence in his abilities to handle the situation. His lack of proactivity and lack of response when addressing the media has diminished his leadership profile. Now we will talk about Bill Gates, a leader who predicted an epidemic back in 2015. Billionaire Microsoft co-founder recently pledged $250 million to combat the disease through his foundation. He gave a 2015 TED Talk warning of potential pandemic and concluded that we are not ready for that. Gates has been an advocate for pandemic preparedness for years, and his Bill and Melinda Gates Foundation is contributing financing to several coronavirus vaccine initiatives. He also gave a 3-point plan for the United States government consisting of a national lockdown, having a comprehensive testing system, and having a data-based approach to develop treatments and vaccines, and urged leaders to not stroke rumors or panic buy. The born a leader / become a leader argument has carried on for decades and is refreshed with each extraordinary leader who takes the stage. No one can say for sure if Bill Gates was born to be a leader, but his life work shows a pattern of actions that illustrate how he's become a legend among historical business leaders. Bill Gates is an interesting study when looking at his leadership styles. He is the antithesis of what one would expect from a great leader. He dropped out of school, pursued a dream, and took risks based on his personal knowledge and creativity instead of what others had taught him. He has a high level of leadership traits, conceptual and human skills, and relationship behavior. His leadership style is one that would be included in the descriptions of a transformational leader. That is because he followed a strong vision, had a passion for the work he was doing, and used that emotion to empower the people that would start following him. Gates is a generous and ethical role model and socially responsible. Now, we would conclude, while economically all countries are different, the leadership styles that we propose not only show the differences between them, but show how each country is working towards an effective solution that limits the risk of the virus without economically crippling that specific country. We must consider, since coronavirus is an ongoing current problem, the information collected in this project changes day by day, but the examples mentioned are set in stone. In this project, we have analyzed one organization, one business leader, and 3 countries. WHO is an organization which is the international leader in public health and advises other countries about the virus and means of viral prevention. Its leadership approaches and different types of power were discussed. Countries typically rely on open systems, and 3 of the countries of the many that were dealing with this issue had their leadership approaches analyzed, consisting of Brazil, Italy, and England. The leadership approaches mentioned are crucial to managing and controlling the population in order to decrease the transmission of the virus and mitigate the losses of a country. The last topic we analyzed was Bill Gates, who is a leader that is financing vaccine initiatives. He shows leadership traits such as transformational and ethic-based leadership, which are important in order to be a successful leader. Now we're going to go on to our reference slide, which we will be emailing you as well. and we want to thank you for watching this presentation and hope that you have learned how so many different leadership models and theories can be seen and understood when addressing this global issue.